Come in.
Hi, I'm student Dr.
Hi.
Yagnik, and I'll be taking care of you
How are you?
today.
I'm Alex. Nice to meet you.
Nice to meet you. So what brings you in?
How's everything on my left foot?
Okay, do you mind if we take a look at it?
Sure.
With one finger, can you point to exactly where?
Right there.
Okay, I see that. So what happened?
I'm not really sure what happened, but I do like to walk around barefoot a lot.
Okay, so that could be why. When did you first notice that?
About a month ago.
About a month ago? Okay, so can you describe a little bit like how it feels?
Yeah, it feels pretty itchy.
Itchy?
Yeah.
Okay, and is it mainly just localized in that area, or do you feel it radiating anywhere?
I would say localized.
Localized? Okay, and is there anything you do to help relieve the itch?
Hydrocortisone cream.
And how helpful is that?
It's pretty helpful.
Helpful? Okay.
Yeah.
And does anything make it worse?
Like I said, just walk around barefoot. I get irritated.
Okay, on a scale of 1 to 10, 1 being no pain, 10 being unbearable, how would you rate it?
I'd rate it about a 2 out of 10.
A 2 out of 10? Okay, you can go ahead and put your foot down.
Okay.
I'm just going to ask you some past medical history questions, and then we'll start the physical exam.
Okay.
Okay, so have you had any recent hospitalizations, surgeries, or blood transfusions?
No.
No? Okay, any illnesses as a child or as an adult?
Chicken pox as a child, none as an adult.
None as an adult? Okay. Are you on any current medications besides the hydrocortisone that you're putting on there?
No, just the cream.
Just the cream? Okay. And do you have any allergies?
I do not.
None? Okay. Are you married?
No.
Are you sexually active?
No.
Do you drink, do any illicit drugs, or smoke?
I drink alcohol.
Okay. How often?
About once a week.
Once a week. Okay. Are you a student?
Yes, I am.
Okay. So how does that affect your sleep cycle?
I sleep about 6 hours every night.
Okay, that's not bad. What about your exercise and diet?
I exercise about 3 times a week, and my diet consists of chicken, rice, and salad.
Okay, good. And do you have any pets?
I do not.
Have you traveled anywhere outside of the country?
No, I haven't.
No? Okay. And this last question just pertains to mom, dad, brother, sister, grandma, grandpa. Any history of major illnesses like diabetes, cancer?
Yeah, my mom has diabetes, and my dad has hypertension.
Okay. And then this last thing is just to make sure that you're alert and oriented. Do you know what time it is right now?
Yes, it's about 3 p.m.
Okay, and what's the date today?
It's February 19, 2019.
Okay, good. Patient is alert and oriented times 3. Okay, so we're done with the questions. I'm going to go ahead and start the physical portion of your exam, if you don't mind just reaching back on the table for me.
Okay.
So the first thing I'm going to do is check your pulses. The first one I'm going to take is your dorsalis pedis, and that is present bilaterally, so I'd give that a 2 out of 4. I'm going to check your posterior tibial, and I'd give that a 2 out of 4 as well. I'm going to go ahead and check your popliteal if you don't mind.
Okay.
I'd give that a 2 out of 4 as well. I'm going to go ahead and check this leg as well, and that is present, so I'd give that a 2 out of 4 as well. And now I'm going to feel for temperature to make sure that you're going from warm to warm, which you are, so that's good. I see that you have normal hair growth. I'm going to check your turgor and elasticity, which is present. And the last thing I'm going to do is a capillary refill test to make sure that your skin is going back from white to pink within 3 seconds, which it is. And this just all shows that you have good blood circulation all throughout your lower extremities.
Okay.
The next exam I'm going to do is the derm exam. And I'm just going to feel for any bumps, lesions, any abnormalities. Check the plantar surface of your foot, check the underside of your leg, and that's all clear. I'm going to do the same thing on this leg, and then check the plantar surface of your wart, which I see that you have that there, and then check the underside of your leg, and that's clear, so that's great. I'm going to check for any macerations in between your toes, and I'm going to check these as well. I don't see anything. I don't see any signs of fungi on any of your nails, and they're all clear, so that's wonderful. The next thing I'm going to do is a musculoskeletal exam. So I'm just going to have you push against my hands, but just checking your muscle strength. Good. If you don't mind just scooching a little bit forward. Thank you. And then you're going to push against my hands, pull forward, and then push. Okay, great. And now I'm just going to do your range of motion exam. I'm just going to check your range of motion, making sure that you have no creaks or cracks and that your joints are moving, and they are, so that's great. And the last thing I'm going to do is a silver sploid exam. So I'm going to put your foot in neutral position, and I'm going to dorsiflex your foot, making sure that you have no signs of equinus. I'm gonna do the same thing, but lift your leg, like a little, perfect. And then I'm gonna push again, great. And then you can set that down. I'm gonna do the same thing on here, put your foot in neutral position. I'm gonna dorsiflex, no signs of equinus. I'm gonna do the same thing. Great, okay. And then the next thing I'm gonna do is the neurological exam. I'm gonna start off with the Sims-Weinstein. This isn't gonna hurt, it's just a little brush. I'm gonna poke you in 10 different spots. With your eyes closed, just let me know when you feel it.
Okay. Now. 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 Now.
Great, I'm gonna do this foot now.
Now. Now. Now. Now. Now. Now. Now. Now. Now.
Great, thank you. And the next thing I'm gonna do is the sharp and dull test. And basically what I'm gonna do is just mark you with either a sharp or a dull item, and you let me know when you feel a sharp or dull, just with your eyes closed.
Dull. Sharp. Dull. Dull.
Perfect. The next thing I'm gonna do is the proprioception exam, and I'm just going to pull up or pull down with one of your toes, and with your eyes closed, you're gonna let me know which toe it is and if I'm pulling up or pulling down.
Okay. Big toe is down. Big toe is up. Pinky toe is down. The second toe is down.
Perfect, thank you. And the next thing I'm gonna do is I'm gonna mark some landmarks on your feet with this, and you're gonna feel a little buzz, and you're just gonna tell me when you feel it.
I feel it. I feel it. I feel it. I feel it.
Okay, wonderful. And the last thing I'm gonna do is check your reflexes. So the first one I'm gonna do is the Babinski reflex. I'm just checking for any upper motor neuron diseases, making sure you have no metatarsal splay, which you don't, so that's good. And then I'm gonna check your patellar tendon reflex, if you don't mind scooching out for me and letting your legs hang. I'm just gonna, good. Good. I'm gonna do your Achilles tendon. Good. Good. Okay, if you don't mind scooching back for me, now we're gonna check the area of concern.
Okay.
Sorry, so much front and back movement.
No problem.
Okay, so what this looks like to me is that it's just a benign wart, which you can get from walking around barefoot. It's just a common viral infection. We can start you off with some salicylic acid, and you just apply it onto your foot. It's an ointment, and it should dry off on its own. And we'll start you off with that for now, and then we'll see you in 2 weeks, and if it comes back, we'll think of what to do from there. But for now, we'll just start you off with the ointment, and we'll see you in 2 weeks.
Okay, thank you so much, Doctor.
Do you have any questions?
No, I do not. You answered every question.
Okay, great. It was really nice meeting you.
Thanks.